very interesting, very involved Facebook Live, YouTube Live, Bloomfield Hills, Michigan. So this is an 80-year-old patient, 80. She comes to me with grade 4 and grade 3 capsular contracture, pain, literally. She had history of breast cancer on the right side and ended up getting mastectomy, and then on the left side, breast cancer in 2021. So when they replaced the implants in 2021, she had known bilateral rupture of silicone implants. So she has history of what is bilateral rupture. I did get the MRI report, which shows that there was a left chest silicone granuloma, which means that the silicone spilled into the chest and it stayed behind, and you're going to see that. That's what I'm going to cut through on the left side. So as you will see, 100% total capsulectomy, 7/30/25, initials JW. I have my sterile gloves. And so what I did was, let me go ahead and again highlight 1989, first set of implants. And then in 2021, those bilateral ruptured silicone implants were noted. And so she has right and left breast cancer with radiation to the left side. So 100% total capsulectomy performed on the right side with this mastectomy scar. She had no radiation. So you can see the quality of the skin is very good. Stitch at 12 o'clock to mark the mastectomy scar. And you can see the very hard capsular tissue. And then what is this right chest mass that I removed from the lateral aspect, and you can see this is the tissue that was indeed very much abnormal. Now these are brand new gloves, sterile gloves, and as you will see as I touch, I'm just evaluating the consistency. So from a cancer perspective, this is an irregular abnormal tissue, what is suggestive of a mass, scar tissue adhesion. I'm going to send this off separately to see what this is and what this is not. Now I have removed the entire implant capsule, 100% total capsulectomy. So let's see what this shows. So as I cut this open, now remember these implants are from 2021, so fairly new. And so as I go in, the entire chest wall has been completely, definitively cleaned out such that there is only good healthy tissue remaining behind. And we have the high definition and pictures and videos for the patient to see. Remember, this tissue right here is bad too, and that's why I removed it. And as I go in, this is consistent with the capsular contracture. Now as I go in, you can see, very interesting, look at this. Very odd. As I go in right here, this is, remember, 2021, and as I go in, looks like a ruptured implant. Very odd, because this is just 4 years old. Very odd. You can see, I'm going to go ahead and use this ruler to show how thin the capsular tissue is, no matter how thin. Very odd that this is what is ruptured implant, and we're going to see it. Because remember, this is just 4 years old. And remember, this goes to showing you, these implants are not safe. And according to Mentor, for example, they want an MRI at year 3, and then every 2 years they're onward. And look at this, total shocker that this implant is ruptured and Mentor implant. And I am just totally surprised that this is a 4-year-old set of implants. And remember, this is supposed to be the nicer, better, safer gummy bear implant. And I'll tell you, there is nothing gummy about this right here. There is nothing gummy about this. And this is your 300 Mentor. And I'm looking at the number. So people ask me, patients ask me, it says 340. So 340 cc implant, and look, there is nothing gummy bear about this. And the elastomer, you can see the shell is very different material compared to the inside. And if anyone says the end block is not critical or total capsulectomy is not critical, I want you to justify leaving the capsule behind or thinking that the implant's not ruptured. Remember, the surgeon has to always go in thinking that the implant's ruptured till proven otherwise. And she certainly did not get a drain on the right or on the left. And overall, I'm very happy, and I'm looking for masses, anything abnormal. I'm very happy and content. So again, total surprise, 4-year-old set of implant on this nice 80-year-old lady, ruptured, and as you can see, why I chose to operate on her, and why she needed this surgery, and why she herself came to me, and why this end block is key. Now on the left side, there's a lot going on. So you can see she had the radiation on the left side. So look at the thickness of the skin. It is so thin. It is so thin that, again, my new sterile gloves, skin is so thin. You can actually see my green glove underneath. Right here you can see. All this flap was removed. It's stitched at 12 o'clock for orientation, so we know this is lateral. This is the 12 o'clock. And then what I removed here was, what is this? Left chest axillary mass. And as I go in, you can see the surgical clips that were removed right here. And I'm going to send this off for oncologic reasons to make sure there is no breast cancer, because remember, she has history of breast cancer, and it's another surgical clip right here. So anything foreign that I see, I remove. This has happened 3 times previously. When I sent this tissue on a cancer patient, it came back for cancer positive. Remember, the surgery was done 2021. Any mass of the chest of a female or even a male is breast cancer till proven otherwise. Now on the left side, this was the done end block. You can see how thin the capsular tissue is. And as you will see, complete entire implant capsule removal. Now as I go in looking at this mass, I incorporated this along with the implant and the capsule. So I'm going to cut this out because I know from the MRI, left chest mass on the MRI is consistent with what is a silicone granuloma, and all this tissue right here is also abnormal. So I'm actually going to cut through this first, all done end block. And I'm going to go ahead and actually cut right into this so you can see, because remember, the eyes don't see what the mind doesn't know. And as I go in, you can see how thick this is. My heavy scissors are being bent. So as I go in, and you will see this is the back of my finger. Let me go in here a little bit more deeper. You can see how hard this mass is right here. I'm going to cut through. It's like a rock. So as you see right here, if you look at the back of my glove, it's nice and clean. And this is a mass that I'm going to send off. You can see right here. Now, we know, given the history of spillage of silicone, this is what it is, and I'm going to send this tissue off. Now I've already entered the space here, and I'm going to cut through this. So this is intact, and I'm going to remove this intact implant. You can see how suffocated this was, compressed and literally congested. Look how thin the glove, how thin the capsule is. You can see my glove, how thin this capsular tissue is. Now as I go in, I'm still fixated on this mass. You can see right here, look at this mass. We saw this on the MRI report, given the history. Remember, you have to always think cancer. So I'm trying to cut through this. It's so hard, like literally a piece of wood that I'm cutting. So I'm going to cut this off. And if you look at this, see that stickiness? This is your silicone granuloma. So again, if I may, if I go here, see that? You see that stickiness? This is that history of that previous rupture. So I have removed all of this bad tissue for a reason, and I'm going to send this off to pathology so we can know that this is indeed a silicone granuloma and it's not breast cancer, if you will. So this tissue again, and I look on the inside, you can see, now this is classically suggestive of what is alloderm, which is cadaveric skin right here. Look at the way it's folded up. This used to be another human skin that was used in reconstruction. You can see the boundary. So removal of alloderm, removal of surgical clips, removal of silicone granuloma. She got the complete surgery. This is alloderm used in reconstruction. And all badness removed. All foreign material removed. And I'm overall very happy and content with how the whole dissection has gone. This was a very tricky and tough surgery, if you ask me. So there are, God knows, at least 10 things we learned from this. Number one, look at this implant right here again. There is nothing gummy, there is nothing safe, there is nothing the newer generation better, safer implant. Look at the way this 2021 implant has disintegrated, and it has basically outpouched, and how it had spread and causing her pain and misery. Number two, you have to always assume that the implant is ruptured till proven otherwise. This is 100% total surprise. A 4-year-old set of implant basically is ruptured, and that's why if you look at the Mentor advertisement, they tell you get an MRI at year 3, and then every 2 years they're onward. Number three, the radiation, the risks of potential complications go up to 30 to 50% because of a radiated chest and the implant-based reconstruction. You can see the super thin ultra flaps, the right and left mastectomy scars, given the history of breast cancer on the right and left. They're going to be going to pathology to rule out breast cancer. Surgical clips, alloderm, foreign material, all to be removed that I find in the proximity for oncologic cancer reasons, so we know that this is not breast cancer. So left chest axillary mass is going to be sent. Left chest mass, which is the silicone granuloma grossly, is going to be sent to pathology separately. Left mastectomy scar to be sent separately, and left breast implant capsule to be sent separately, and the implant will be returned to the patient. And what I want to do here is, over here, Mentor 360cc implant, again intact. The other thing I want to mention is, yes, you can drive an F-150 like you have seen on the many videos over this, but I will tell you, when you're incubating it at 98.5 and it's going through the stresses of the capsular contracture and literally repetitive daily trauma, it is only going to rupture sooner or later. Any masses, abnormalities are to be sent separately so that we have a complete, thorough, meticulous workup, so that when the patient looks back at it, and especially looking at the pictures of the chest wall. So this is the most important thing. Any patient who's interested in getting an explant, in my practice, I tell them you will get to see the chest wall high definition videos and pictures showing complete removal of all the badness as you see here, so that there's complete transparency as to what was found, what was an incidental finding of a ruptured right implant. And I use the word what a shame to say that this is safe. How wrong can be to say and justify that the implants are the better, nicer gummy bear, and the many patients that they believe that have been told that they last forever. Absolutely not true, as you can see. And so, complete thorough workup. This is where no need for drainage. She's going to get an aesthetic flat chest closure, and most importantly, we'll see how she does in regards to her back, the inflammation on her neck and back from the ruptured implant and from the implant itself, even though it was not ruptured on the left side, the pain that she had from the capsular contracture, and the freedom from the silicone toxicity that she clearly, as you can see, was experiencing. I personally did not want to operate on this patient given her age, but the decision was made because no one should live in pain. No one should have to live with pain and misery, and this is why ultimately the goal is do no harm. This is Dr. Khan, Executive Plastic Surgeon.